My name's Jo Sutton. I'm the Nursing Associate Lead for Primary Care based at Devon Training Hub, and I'm joined today by Dawn. Dawn, would you like to introduce yourself?
My name is Dawn Knott. I was a HCA and now a qualified NA. Yeah.
And Dawn's joined me today to talk about her journey to become a registered nursing associate. Would you mind just telling us how you got to your position today? Thank you.
Well, I was 52 when I started it, and I was in GP land in a practice, doing the basic HCA job of bloods, ECG. What else was I doing? Doing reviews for mental health, learning disabilities, chronic heart disease, and blood pressures. And when you do it for a long period of time, like I had, I was getting a bit
Hmm.
bored. And I did fancy a change. And I'd gone on an ear irrigation course with a girl, and she came in and she said she was doing the new role of this TNA where they go off to university. And she said, "You're smarter than me, Dawn. Why don't you do it?" I said, "Because I'm 52 and I am completely useless on computers." She said, "Just look into it." So she sent me the details about it. And I thought, oh, that's something I really fancy doing. So I spoke to my manager in my practice, and I said, because I fancy doing it quite a lot, and I may even possibly go the route of going to the hospital as in a new role, because I felt like I wasn't going any further forward really. And I think I scared them a little bit, and they thought they would put me through. So because it was new in GP land, there wasn't very
Sure.
many
Yeah.
doing it. So yes, they backed me financially, and I went 1 day a week, and it was Bolton University. Very supported. It was the first 3 months, I think, where I found it the most difficult because there were so
Yeah.
many IT platforms, so many things to access, and being completely illiterate with computers, I found that a struggle. The work, not so much.
Yeah.
I did okay going through the course. I'm having my graduation in October, so I'm excited
Yeah.
about that. I,
Congratulations.
Thank you. I've never gone to university, so I was a complete green novice,
Hmm.
but I loved it. And I used to get excited every time we get something to do, and I'd work towards it, and I'd take a couple of days out, a couple of afternoons. So I do Thursday afternoon and Sunday afternoon and work on
Yeah.
it to perfect it so I wasn't too stressed. And then when I hand it in, the relief of handing it in, and then the
Yeah.
excitement when you get the results. And I just disappointed when it was over, really.
Yeah.
So
That's great.
half of me feels, oh, should I have gone on? Should I have done nursing? But I actually think it was getting harder towards the end. But I did
Sure.
enjoy my
Yeah.
2 years,
That's
and I'd
lovely.
recommend it for everybody.
So you felt you learned academically, and did you go on some external placements as well?
Yeah,
Clinical placements?
yes, we did. And ideally, I wanted something like outpatient E type
Hmm.
things. So I didn't really want to do ward based, although I did do
Sure.
a couple.
Yeah.
I went on Victoria and Barnstable, which is like a heart, all about the heart,
Yeah.
cardiac care, etc. I went on a cancer ward. I went on a children's ward. I went into outpatients.
Yeah.
I went into a hospital, like a small cottage hospital in Bideford. I went out with the nurses in the community. So I did lots of things. And
Yeah.
while I was there in the community, in the afternoons, they wrote their notes up. I actually went into the hospital and went and befriended one of the nurses on the desk and just said, "What other things are going on here?"
Mm.
So I had an opportunity to go into ophthalmology. I went and spoke to a midwife and spent the afternoon
Yeah.
with her. I spoke to a physiotherapist. So I made use of all my time, and I think,
Yeah.
there's always something to learn. There's no wasted
Absolutely.
placement,
Yeah.
definitely.
And you learnt things that you could bring back to general practice as well?
Yeah,
Yeah.
yeah. We learned about special measures within the children's hospital,
Mm.
in the Caroline Thorpe ward. And I brought it back to use for my learning disability patients
Yeah. That's
about,
brilliant. Example.
heading different ways of making changes that it makes it easier and less formal and less of a frightening place to come into. So yeah, it was very
Sure.
good.
Yeah, that's
Yeah.
great. And now you're registered, and does the learning stop there? Now you've become a registered nursing
Yeah.
associate?
It does, the steam's out of it. There's no pressured deadlines, but
Sure.
yeah, I'm doing lots of little courses. I've just completed a
Yeah.
hypertension course. That was very interesting. And there's always those little things that you don't know and little gaps that it's nice to have filled in and rounded
Yeah.
off.
Yeah.
And you know, even now there were still no questions that are stupid questions, because
No.
you know, you're still learning. And
Yeah.
I don't, the day you stop learning is the day that you know, it's a mistake, isn't it? The mistake
Yeah.
will happen. You
Yeah.
become too complacent within your job.
Sure. And it's a career you go into and there's lifelong learning throughout it, really, isn't there? Yeah. Yeah. So any advice for any colleagues who might be thinking about going down the route that you have taken?
Firstly, do it.
Yes.
You're never too old and you're never too young.
Yeah.
Just do it, embrace it. You may not want to go on to be the nurse and the full responsibility that is, but this gives you another step closer. And actually, you get a lot of confidence from it. You get a lot of pride in what you've done and what you've achieved.
Yeah.
And people look at you a bit differently. The doctors, I mean, they always looked at me a bit strange anyway, but they do take notice of me more so because I have the knowledge to back up what I'm saying. And
Yeah.
they're, you know, they've said it a couple of times. Oh, Dawn, you're so knowledgeable. Well, I
Yeah.
am now, because I
Yeah.
know why I'm saying I think this needs to be checked, or
Sure.
I'm worried about this patient because A, B, and C, and I have the backing up of my education for it. So
Yeah.
yes, don't hesitate, just do it. I loved it. I'm sad that it's over, but yeah, it was great. It was a
Yeah.
great experience. And I knew I didn't do it sort of long time ago, or
Sure.
it wasn't about long time ago,
Yeah.
you know, because my path could have been so different, you know.
Yeah.
But I
Yeah.
am enjoying it. I do enjoy helping people and, you know, making a difference, because you do make a difference, you know.
Yeah. That's brilliant. And that's a lovely point to end on, Dawn. Thank you very much for your time.